Wanted to ask you a question about pharmacy benefits managers. Asked Secretary Levine, she said, I need to ask you. So you're the lucky person who gets to answer the question today. So West Virginia found a savings of $30 million per quarter when they moved from spread pricing to pass-through pricing. Ohio found they were being overcharged $245 million because of spread pricing. New York proved that spread pricing cost them $300 million. So, based on all the work that the Auditor General has done and some of the work being done here in the General Assembly, what is Pennsylvania doing to stop spread pricing, and how much money do you believe it will save the Commonwealth?
So, DHS doesn't regulate pharmacy benefit managers. We contract with managed care organizations to provide Medicaid-covered services to beneficiaries. The MCOs may choose to contract with PBMs, and DHS does review all MCO subcontracts, so we would be able to review the contract they have with the PBM. But the PBM then establishes their pharmacy provider network, and the contracts between that PBM and the pharmacies are not subject to DHS review. But in response to the need for greater transparency in payment for drugs and MCO accountability, we amended our 2019 physical health and CHC MCO agreements. The department will now receive information on the price that the MCO paid to the PBM and that the PBM paid to the pharmacy for each claim. And additionally, PBMs will no longer be able to retain drug rebates. Those rebates would be returned to the MCOs, and then that will then be taken into account during our rate setting process. The MCOs also have requirements to audit the PBMs at the department's request. And to assist independent pharmacists, they can now appeal directly to the MCO if they're not satisfied with the PBM's resolution of their appeal. And all of these things were, again, part of our 2019 agreement. So part of the way we're addressing this is trying to find out what's actually going on. And then if we see issues, I think we can certainly talk about ways to address it. But we're starting out with transparency to really find out what's happening.
Well, I certainly appreciate that transparency because, the PBMs really serve some of our neediest and most vulnerable citizens, and your budget continues to grow and grow year over year. So, finding savings and increasing that transparency is a good thing. Do you have any sense of how much these measures will save the Commonwealth?
In terms of our transparency efforts?
Right.
I think the transparency efforts are just going to shed light on the issue, and then
Correct.
we can see through that if there's a problem and we need to do something more. And frankly, we change our agreements with our MCOs every year. So I think we feel like we have the ability through those agreements. If we need to clamp down and do something further in out years, I think we would have the ability to do that. But we're just trying to figure out what's going on now and then figure out what we need to do.
So that data will help us
Exactly.
achieve future savings.
Exactly.
Thank you. If I may, a question on surgery center tax. Last year, the governor proposed a new tax on our community-based surgery centers. The places where people go for routine, not high-risk type of surgeries, and they provide that care at a lower cost than having it done in a hospital. In 2017, the General Assembly passed legislation to encourage the use of those facilities because there are cost savings, and that tax seems to be contrary to the intent and of those previous legislative efforts. So it wasn't included in last year's budget, but I see that the governor is again proposing that tax on our ambulatory surgery centers. I have one in my district. Could you help me understand why it's good to tax a healthcare center or service that is creating savings for the system overall? I mean, reducing our overall healthcare costs is certainly important, particularly for our Medicaid populations.
Yeah, I'm going to take this one if you don't mind. And I think you're right. We are fans of ambulatory surgical centers, and we're fans of serving people there whenever it's possible. Through our stakeholder engagement with those associations last year, when the governor proposed the ambulatory surgical center assessment, we arrived at information that only about 6% of the revenues of those ambulatory surgical centers were derived from Medicaid, meaning they're not highly utilized in our current system. And I agree, they are cost-effective alternatives to inpatient care, and we would like to see them utilized more in our program. So we engaged with a lot of stakeholders after.
So hold on a moment. Let me understand this. So you think that they're good.
Yes.
You'd like to see them more engaged in care, and so your response is to tax them more.
Well, I have some additional information. So after last year's discussions, one of the big things that we heard from the ambulatory surgical centers is that it was not cost effective for them to provide care to our Medicaid population because of our relatively low reimbursement rate. So we went back, we did some more modeling, we got some more updated information, and this year's proposal puts forward an option that would implement a provider assessment similar to some other assessments that we have, where we're able to also increase payment rates to the ambulatory surgical centers to encourage their participation in Medicaid.
So you're going to tax them and then give that money back to them when they provide care to Medicaid patients?
Yes, we have a lot of provider assessments set up just like this that help to fund the program.
And how exactly, I'm still struggling to understand this, how exactly does that improve care?
Well, I think it's encouraging the ambulatory surgical centers to participate in the Medicaid program above and beyond what they're participating today.
So essentially you're taxing everyone though, not just, you're taxing the privately insured, you're taxing everyone in order to drive different set of patients to a care facility. Is that what you're doing?
Yes.
Thank you.
Sure.